Well, each and every Friday, we're fortunate enough to check in with Dr. Richard Pan, who was kind enough to join us again here on the phone lines. Dr. Pan, how are you this Friday?
Been working on the state budget, but keeping busy. Thank you.
Well, there's so many things going on in our world, obviously, and COVID-19 is still front and center for everyone here. We kind of do this each week to kind of check in. Where do you feel like we are now that things are loosening up, not only in our state, but certainly across the United States?
Well, unfortunately, we are marking a rather grim milestone in the country where we have over 100,000 confirmed deaths from coronavirus in our country. And I think while we're making progress, certainly that's something that we need to acknowledge. California actually is at the point where we're approaching 4,000. Now, we're 12% of the population, so proportionally we're at probably about a third of where, if things were spread evenly, of what you would expect for California. So that shows that what we've been doing in California has been working, and that we've been more successful than the rest of the country. But I'll also make note that we still have almost 4,000 dead here in California alone. And it's a grim reminder that the virus is out there, and we still need to be careful, that we shouldn't take our previous success for granted. So I think it is something that people need to keep in mind. And I know last weekend was Memorial Day weekend, and so it's good to get outside, and that's fine. Getting outside is fine. But we also have to remember that let's continue to do the things we've been doing to slow the spread of the virus and prevent more people from getting sick.
Dr. Richard Pan with us. Doc, the spread of this virus isn't the only thing spreading. I think a lot of people are just so frustrated with the spread of news, be it factual or not. And I admit, I try to educate myself as much as possible, but sometimes I hear things on many sides that are seemingly good points. Masks work. Masks don't work. You should wear them out. You should not wear them out. The death toll's this. Nope, it's that. These states that opened early aren't seeing a rise. These states that locked everything down, they are seeing a rise. Why, in your opinion, as a lifelong medical professional and somebody who understands medicine and science better than any of us, why are there so many things being switched, backtracked, and so many things that have been gotten wrong along the way? Is it just that it's a new virus?
Well, first of all, we do have to keep in mind that it's a new virus, and I know I keep saying that. Remember that the first known case of a COVID death in the United States happened in early February. All right, there might have been some before that we don't know about, but we're talking early February. The first reported cases of coronavirus in humans happened a little more than a month before that, and we're about to wrap up May, so it hasn't been that long. So I think challenge number one is that as the virus has spread, we are learning more about it every week, but there's still a lot we don't know, and so that's why sometimes you also get changing recommendations, because as we learn more, we can get better recommendations. That doesn't mean that the previous recommendation was necessarily wrong for the time, given what we knew, but it is, as we learn more, there are things that we know. So we've talked about things like, wearing masks, and when it first started, especially since we need to protect the supply of masks for people who need to work in healthcare settings and other places, we generally told people, well, probably don't wear masks because you don't want to use up the masks in the general public because the rate was very low, so the odds of catching it in public were still low. And then now it's wear a mask because this virus is among us, and it does prevent transmission, or it slows down the transmission if you happen to be one of the people who are asymptomatic, didn't have the symptoms, and infectious, that it would make it much less likely you would transmit it to someone else. So what did we learn? Well, first of all, our supply of masks has increased. We also learned that people who are asymptomatic or don't have symptoms are often the source of spread in our general community. And as the numbers went up, it became more and more important to be sure that people who didn't have symptoms and therefore didn't know they had the disease or the virus were not spreading the virus, right? So things do change over time, and that's challenge number one. Unfortunately, on top of that, we haven't been getting necessarily consistent guidance from some of our government leaders, particularly at the federal level. There's been some back and forth there. And also there, unfortunately, on social media, there's been the spread of a lot of misinformation as well. So that tends to confuse the matter. So you start off with the fact that we have holes in our knowledge, which we're trying to fill, but there's still many of them, on top of people spreading misinformation or making erroneous statements. And that certainly gets very, very confusing for people.
Dr. Richard Pan with us. You know, one of the things as we're trying to get back to a little bit of a return to work and different things in restaurants and economy building back up, people have talked about, and you've mentioned it before, about one way would be to maybe have check temperatures, you know, of people when they arrive at some of these buildings in different places. But when you're asymptomatic, how would that, isn't that null and void? Is there need to be more testing than that to kind of prevent some of this spreading?
Yes, because you're right. Actually, temperature screening is not a very effective mechanism alone in slowing the spread of the disease, because, as I said, the source of spread may be someone who's totally asymptomatic. They don't have a fever at all. So, you know, doing temperature checks is a way of trying to catch some people who may not be aware that they're sick, or may be aware that they're sick, but for various reasons still want to go about or go to work or whatever other situation there is. So by itself, it's not enough. It is one way to try to screen people, but we still need to be sure we're testing more people, particularly people in high-risk situations. So we're talking about essential workers who are out in public spaces where they may be exposed to large numbers of people, or healthcare settings where the virus might be around, places where there's a lot of vulnerable people, like nursing homes. In fact, we are testing people in nursing homes by state order on a more regular basis. And then we need to, of course, anytime someone's positive, we need to be testing all their contacts. So we need to, that's contact tracing piece. So if someone is positive, we need to find out who they've been in touch with and then test all of those people as well. And then when someone is positive, we need to be able to isolate them so they can't infect other people. If they happen to live home alone, they can stay at home. If they happen to live in a situation where it's a lot of people, or there's vulnerable people, or they're homeless, then we need to have a place to put them so they don't spread the disease farther. And that's called test, trace, isolate. And that's one mechanism by which we can contain the infection. In fact, it's being used successfully in some other countries around the world, like New Zealand and Taiwan and South Korea.
Dr. Richard Pan joining us. Doc, I always assume you've seen everything far before I have, but just in case, 3 of the states that have really been in the news recently having more of an aggressive stance on reopening: Florida, Texas, and Georgia. I saw these numbers floating around yesterday, and what they are 5-year trends for pneumonia in each state. And I won't go through all 15, but just going from 2018 to 2019, or to 2020, excuse me, in Florida, 935 deaths last year of pneumonia. This year, 4,259. In Texas, last year, 973 died of pneumonia. This year, 4,217. And in Georgia, 474 versus 1,368. Are people shifting numbers around? Is that much ado about nothing? Or is somebody who's very invested in accurate counts, do you look at those numbers and scratch your chin and think there's something we're missing there?
Well, I think those numbers do indicate that something's going on that we're not picking up, right? So one of the things when we look at this outbreak is, for example, we talked about 100,000 deaths, and it's probably an undercount. And some people say, well, how do you know it's an undercount, right? Why can't it be an overcount? And one of the ways we cross-check these things is, for example, since we're talking about deaths, we look at what I call excess mortality, right? So we have records of what death rates are at different times of the year for different locations. And we go, okay, well, over the past 10 years, on average, we generally have this many people will die at this time of the year because we'll have flu or traffic accidents, heart attacks, whatever else cause people to die. And we can look at that. And then we compare that to this year, coronavirus, which, by the way, we do know that we still don't have enough tests. We're making strong progress here in California. I think we can do about 60,000 tests a day, which is good. We still probably should get closer to 80, maybe 100. But we're well on our way to in terms of the raw number of tests here in California. But I would point out that when you look at these things like excess mortality or looking at pneumonia trends, if there are more than normal and it's a symptom related to coronavirus, then you do have to ask the question, so what changed this year, right? So when something is unusual, you have to say, well, what changed that might have caused this? And certainly, while we can't say for sure, it's probably likely the biggest change that's happening that would cause a change in the rate of pneumonia would be the coronavirus, because it causes lung disease. So we don't have too many other things going on right now that we expect would cause a sudden change in pneumonia rates. So it does raise the issue of, well, are they doing enough testing? How are they reporting things and so forth? And is the virus spreading more quickly than we can determine? So actually, I would point out, for example, in California early on, one of the things we were monitoring, because we didn't have enough testing and we knew we couldn't test everybody, was we were trying to monitor hospitalization rates, right? And so that's one of the measures we look at, because we expect that if people get infected, a certain percentage of people will end up in the hospital. So even if we don't know for sure it's coronavirus, if the hospitalization rate starts skyrocketing, then you have to go, well, maybe that means coronavirus is spreading faster than we're picking up through our testing. And so I think that's one of those things that someone needs to pay attention to.
Dr. Pan, I'm curious on your perception of this world trying to get back into its regular function, I guess, yes. But including the sports world. We're hearing Major League Baseball, the NBA trying to get back. What's your opinion? I know we don't know all their protocols yet, but of them, just the principle of them trying to get back in a bubble city, maybe in Orlando, or Major League Baseball returning to their parks. What do you think about those proposed ideas? So
I think that we could certainly get to a place where teams may play games without a live audience, people gathering in the stadium, because in order to prevent a large spread of disease, we can't have people in large gatherings, right? And even if we're successful in being able to test and screen lots of people through testing and then contact tracing, having large numbers of people spend time together. So if you're in a game, you got to think you're all together, shoulder to shoulder, for at least a couple hours. That is a ripe situation for the spread of the disease to a lot of people, and those kind of circumstances is something that I think we want to particularly avoid for a long time to prevent this disease from rapidly spreading. And in fact, usually the way this disease is spreading is when we look at the numbers and we're looking at a large baseline population, we sort of think of it as being kind of a smooth trend, but it's actually not. It goes in bursts, and where the bursts happen is that when someone is able to infect a lot of other people. So, we've had in Northern California, I think we had some church services up in Mendocino and Butte counties, which had low number of cases, but suddenly now you had a certain burst of cases because there were large numbers of people, not as many as in a basketball game or a football game, right. But who are together, and suddenly it looks like there was a spread there, right? And we've certainly had other cases as well where people have gathered and suddenly people had spread. So it really is about the opportunities for people to get in contact with each other, to spread the disease. And so if you just have one or two asymptomatic people and they're now in the crowd, there's an opportunity for a lot more people to catch the disease and continue spreading it.
Well, as we talked about, the NBA is seemingly on the verge of resuming their season, such as it is in Orlando, allowing family members in a limited capacity to travel with players, to have what would appear to be a 1 to 2 month season with playoffs, and allowing for people to sign out basically and sign back in if they need to hit a store or go somewhere off campus. Now, we could talk about the economical effects. We could talk about the entertainment effects. I want to ask you from a purely medical standpoint. From a medical standpoint, do you believe that something like that can be pulled off with the benefits outweighing the risk? Is it a risk that is understandable to take, or in your medical opinion, do you think the NBA is setting itself up for failure by doing that?
Well, I think the big challenge is going to be, are they able to screen all the people involved frequently enough and contain the virus if it gets to one of its players or coaches, and prevent it from spreading to not only other people on the team, but to the other team, because as people are interacting and playing. So I'm assuming that we're not doing any live events where, when I say live, meaning with a live audience. But the challenge is that you have, imagine each team, and so that's the players and the coaches and so forth, as being sort of a bubble, right? And because they're probably spending time with each other in practice and other types of things. So you got to think about spread within the bubble, and then their interaction with the general public. So that has to be extremely limited. And now they're going to be interacting with other bubbles, right? So those are the opposing teams who they're playing, right? So so the challenge is going to be is if someone is infected and they're asymptomatic, how quickly can you catch that and contain that before that infection both spreads within the one bubble or gets to another bubble, right? Another team and their players and coaches and everyone else who's interacting there. And I think that's going to be a bit challenging, right? In some senses, what you kind of have to do is get the team and all, the coaches and everyone who's associated essentially isolated from the general public for long enough to be sure there's no infection. They're constantly testing to be sure that there's no infection. Essentially, probably someone's going to be picking up their groceries for them and so forth, and being sure that doing everything they can to prevent the disease from entering into this collection of people, because this collection of people are going to now interact with other collections of people from other cities and other parts of the country in playing games and probably empty arenas where there's lots of cameras so we can all enjoy the game virtually. So it could be done. It's going to take a lot of work, and while this may not be unfamiliar to some of the players who, being famous people, probably don't interact with the public as in general that much, but it depends on the player. But basically, they would have to try to really isolate themselves and keep themselves isolated from the public for throughout the season to prevent basically infection. Because as soon as an infection starts, everyone who's positive needs to be isolated. They're out for 2+ weeks at least until they're tested negative, and so you could lose a good chunk of your team that way in a very short order.
Dr. Richard Pan joins us each and every week, taking time out of his extremely busy schedule, not just as a doctor, but a state senator, as he said at the beginning of the interview, working on the California state budget, which I'm sure is just a lot of fun and hijinks there in those meetings.
Right.
Dr. Pan also has a podcast, and as always, I will retweet the link. We will as well after we get done with this interview. Doc, your time, we say it every week, but your time is appreciated. You're doing a tremendous public service. Our audience appreciates you. Thank you so much for everything.
Well, thank you so very much. Really appreciate this opportunity to talk to everyone. Thank you.
All right, thank you. That's
take care.
Dr. Richard Pan. Yeah, generous each and every Friday, though. You can look forward to just getting the latest, because it does change as we